Good day, viewers and listeners, and welcome to the COVID-19 update for today, April 6, 2022. I am Shania Gonzalez. Good morning, Dr. Anthony, and thank you for joining us today for another COVID-19 update. Minister, you mentioned previously the ministry's plan to visit schools across Guyana to boost the uptake in vaccination. Can you say when this is expected to start?
Well, we are finalizing those plans with the Ministry of Education. We hope to finalize them during next week. Once that is done, we will start rolling out the plan. But as you know, this month we will celebrate vaccination week. And during that week, we want to heighten the arrangements that we have for vaccination. So we have several groups that we are targeting. We want to, of course, increase our COVID-19 vaccination rates during this period. So we will be running some special campaigns to make sure that we can encourage more people to come out and get vaccinated. So in all age categories, we'll be working on. Then secondly, during that week, we also want to get more people or school-age persons to take the HPV vaccination. So we'll be doing a separate campaign encouraging people to take the HPV vaccination. And we are also going to focus our attention on the under 5s. So children who need other types of vaccines, but who are under 5, we want to make sure that they have received those vaccines. As you know, we have a vaccination schedule, and we want to make sure that every child that is eligible for those vaccines have received them. So during this week, we'll be doing a lot of work across the country with different types of vaccines. We would have had a slight increase in our vaccination numbers. So currently for adults, we are now at 438,641 doses. That's approximately 85.5% of the adult population would have received a first dose vaccine. Second dose for adults is 337,531 doses, or 65.8% of our adult population. Similarly, for adolescents, we now have 34,347 doses administered. That's about 47.1% of that age cohort, 12 to 17. Second dose is 25,074 doses, or 34.4% of that age cohort. And booster doses have gone up slightly. We are now at 59,325 doses.
Minister, now in international news, a new COVID-19 variant XE has been found in the UK. What do we know about this variant at this time?
So in January, because of genomic sequencing, the UK detected a variant or a subvariant that had both characteristics of BA1 and BA2. So if we go back a little bit, in terms of Omicron, the variant that is currently circulating, it has a number of subvariants, BA1, BA2, BA3. And what the UK discovered is now you have a new variant that is emerging, that is a merger of BA1 and BA2. So the characteristics of BA1 and BA2 has merged to form a different variant. That variant they estimate to be 10% more transmissible, but however they haven't seen much clinical changes with the variant. They are also tracking it to see if that is going to become more dominant. So far they're tracking it, but we haven't seen any change in clinical outcomes. But that's something we have to keep working on.
You have been watching today's COVID-19 update. For more information, you can visit the Ministry of Health's website at health.gov.gy, DPI's website, dpi.gov.gy, and our social media platforms. I am Shania Gonzalez. Goodbye.